The future of digital health, your world in 2030. Hey there, future explorers. Welcome back to Guy Observed Online. Before we jump into this mind-blowing finale of our digital health series, hit that subscribe button and ring the notification bell. Trust me, you'll want to be first in line for what's coming next. Close your eyes for a moment and imagine waking up in the year 2030. Your smart bed has already analyzed your sleep patterns and quietly adjusted your room's temperature and lighting based on your body's needs. Your bathroom mirror scans your face, noting that slight change in your skin tone that might indicate an iron deficiency. Your toothbrush analyzes your breath biomarkers, and your toilet performs a quick health check that would make any current-day medical lab jealous. Sound like science fiction? Every single technology I just mentioned is already in development. If you're as excited about the future of healthcare as I am, smash that like button. Let's see how many fellow health tech enthusiasts are watching. Today, we're diving deep into 4 revolutionary technologies that are about to transform healthcare forever. But first, let me introduce you to someone special. Meet Emma, an 8-year-old girl who was diagnosed with a rare genetic condition. Just 5 years ago, her parents were told there was no treatment available. But thanks to AI-powered drug discovery, Emma is now part of a clinical trial that's showing incredible promise. Her story is just the beginning of what's possible. Let's start with our first breakthrough: AI-powered drug discovery. Now, I know what you're thinking. Another AI story? But this is different. Let me show you why. Imagine trying to solve a puzzle with 10 law 60 possible combinations. That's a 1 followed by 60 zeros. That's what traditional drug discovery feels like. Scientists would spend years testing individual compounds, hoping to find one that works. But here's where it gets exciting. Dr. Sarah Chen, a pioneer in AI drug discovery, invited me to her lab last week. "Look at this screen," she says, pointing to a massive display filled with molecular structures. "Our AI system just analyzed more compounds in the last hour than all scientists combined could study in a lifetime." But here's the mind-blowing part. The AI doesn't just test random combinations. It learns from each analysis, getting smarter and more precise with every iteration. Want to know something incredible? The AI recently discovered a new antibiotic that works differently from any existing drug. It found this by identifying patterns that humans had overlooked for decades. Drop a in the comments if this blows your mind as much as it does mine. But let's get even smaller, literally. Our second breakthrough takes us into the world of nanorobotic surgery. Dr. James Martinez, who leads the nanorobotics lab at Tech Innovation Center, shows me something that looks like a scene from a sci-fi movie. Tiny robots, smaller than human cells, swimming through artificial blood vessels. These nanobots are like tiny surgeons, Dr. Martinez explains while controlling one through a virtual reality interface. They can navigate through blood vessels, deliver medications directly to cancer cells, or repair damaged tissue from the inside. I watch in awe as a swarm of nanobots collaboratively removes a simulated blood clot, each bot performing its specialized task in perfect coordination. Here's a wild thought. These nanobots could one day patrol our bodies 24/7, preventing diseases before they even start. Imagine never having to worry about heart attacks because tiny robots keep your arteries clear at all times. Quick pause. If you're finding this information valuable, give this video a thumbs up. It helps us reach more people who are curious about the future of healthcare. Now, let's talk about something that sounds straight out of a cyberpunk novel: brain mapping technology. Dr. Maya Patel's laboratory looks like NASA's mission control, but instead of monitoring spacecraft, they're watching thoughts form in real time. What you're seeing, Dr. Patel says, pointing to a holographic display of neural pathways lighting up like a Christmas tree, is someone thinking about moving their right hand. But here's where it gets incredible. They're not just watching. They're translating these thoughts into actions. I witnessed something extraordinary during my visit. Mark, a paralysis patient, was able to control a robotic arm using just his thoughts. The precision was amazing. He could pick up a cup of coffee, take a sip, and set it down as naturally as you or I would. "This is just the beginning," Mark tells me with a smile. "Soon we'll have full body suits controlled directly by our brains." The implications go far beyond helping paralyzed patients. This technology could revolutionize how we interact with computers, control smart home devices, or even communicate with each other. Imagine sending a message just by thinking it. Let's switch gears to our fourth breakthrough: regenerative medicine. Dr. Alex Thompson's lab looks like a cross between a traditional operating room and a 3D printing facility. That's because they're literally printing living tissue. Watch this. Dr. Thompson says, starting up a specialized bioprinter. I observe in amazement as it builds a blood vessel layer by layer. The real breakthrough isn't just printing the structure, she explains. It's creating tissue that can integrate with the body and grow naturally. Here's something that will blow your mind. They're working on printing mini organs that can be used to test medications before trying them on patients. Imagine having a tiny copy of your liver that doctors can use to test different treatments risk-free. But here's where all these technologies converge to create something truly revolutionary. Picture this scenario. AI systems design a personalized medication for your specific genetic makeup. Nanobots deliver it precisely where it's needed in your body. Brain mapping technology monitors the effects in real time. And if any tissue repair is needed, regenerative medicine provides perfectly matched replacement tissue. Let me share a story that brings this all together. Remember Emma, the girl I mentioned earlier? The AI system that designed her treatment used data from her brain mapping to understand exactly how her condition affected her neural pathways. The medication is delivered by targeted nanocarriers, and her doctors can watch in real time as her body responds to the treatment. Now, I know what many of you are thinking. This all sounds expensive. Won't this just be for the wealthy? Here's the surprising part. Many experts believe these technologies will actually make healthcare more affordable. AI drug discovery dramatically reduces development costs. Nanobots could prevent expensive surgeries. Brain mapping allows for more precise treatments. And regenerative medicine could eliminate the need for long-term medication in many cases. Drop in the comments if you've ever wished for more personalized healthcare. What would you want doctors to know about your body that they can't measure today? Let's talk timeline. When will we see these technologies in our local hospitals? Some are closer than you think. AI drug discovery is already happening. The first nanobot treatments are in clinical trials. Brain mapping is helping paralyzed patients today. And simple tissue printing is already being used for skin grafts. But here's what really excites me about the future of healthcare. It's becoming proactive rather than reactive. Instead of waiting for symptoms to appear, these technologies will help us prevent diseases before they start. It's like having a check engine light for your body. Before we wrap up, let's play a quick game. I want you to imagine you're designing the hospital room of 2030. What would you include? A brain-computer interface that lets you control everything with your thoughts? Nano-diagnostic toilets? AI doctors available 24/7? Share your ideas in the comments below. As we conclude this digital health series, remember that the future of healthcare isn't just about technology. It's about making healthcare more personal, more effective, and more accessible for everyone. Whether you're a healthcare professional, a patient, or just someone interested in the future, you're part of this incredible journey. If you've enjoyed this exploration of future health technologies, make sure you're subscribed to GAIobserve.online and have that notification bell activated. Our next series will dive deep into the ethics of AI in medicine, and you won't want to miss it. Share this video with someone who needs hope about the future of healthcare. Whether they're dealing with chronic conditions, caring for loved ones, or just curious about what's coming next, this glimpse into the future might just brighten their day. Thank you for being part of this amazing journey through digital health. Remember to check out our full playlist for all 5 episodes, and keep an eye on how these predictions become reality. The future of healthcare is being written right now, and you're part of that story. Stay healthy, stay curious, and I'll see you in our next series.